Chapter 2, Getting Diagnosed. Navigating the healthcare system can feel like traversing a minefield, especially when you're dealing with a condition that's often misunderstood or overlooked. If you're reading this, chances are you've experienced symptoms that don't add up, and you're searching for answers. This chapter is your roadmap to getting diagnosed with Hypermobility Spectrum Disorder, HSD, or Hypermobile Ehlers-Danlos Syndrome, hEDS. Recognizing the symptoms. The first step towards a diagnosis is understanding what to look for. Hypermobility disorders manifest in various ways, and symptoms differ from person to person. Here are some common signs you shouldn't ignore. Joint-related symptoms. Frequent sprains and strains. Do you injure yourself easily during routine activities? Joint pain. Persistent aches in your joints even when you're not active. Dislocations and subluxations. Have your joints ever slipped out of place? Hyperextensibility. Can you move your joints beyond the typical range of motion? Systemic symptoms. Chronic fatigue, feeling exhausted despite adequate rest. Autonomic dysfunction. Symptoms like dizziness upon standing, rapid heartbeat, or digestive issues. Skin characteristics. Soft, stretchy skin that bruises easily. Poor wound healing, cuts and bruises that take longer to heal, and atrophic scarring, which you can see a really great example of on my hands. Personal reflection. Looking back, I realized I had many of these symptoms, but dismissed them as inconsequential. I thought frequent ankle sprains were just part of being active. It wasn't until my health drastically declined that I connected the dots. Seeking out the right professionals. Once you've recognized that something isn't right, the next challenge is finding a healthcare provider who understands hypermobility disorders. Start with your primary care physician. Your PCP is your first point of contact. Be prepared for the possibility that they may not be familiar with HSD/hEDS. Don't let this discourage you. Come prepared. Bring a detailed list of your symptoms, medical history, and any family history or similar issues. I'll discuss this more in later chapters. Be direct. Clearly express your concerns and why you believe you might have a hypermobility disorder. Consider visiting the Ehlers-Danlos Society's website to print out a copy of the diagnostic criteria checklist. Bringing this to your doctor's appointment can help guide the discussion in a way that will get you seen by the specialists that you may need. Specialists to consider. Rheumatologists, orthopedic specialists. Specialize in joint and connective tissue disorders and sports injuries. Geneticists can conduct genetic testing to rule out other types of Ehlers-Danlos syndrome or connective tissue disorders. Cardiologists evaluate cardiovascular symptoms like POTS. Neurologists assess nerve-related entrapment and ANS symptoms. Tips for finding the right specialist. Research. Look for doctors who have experience with EDS or hypermobility. Support groups. Online communities can offer recommendations based on personal experiences, and be willing to travel. You might need to go outside of your local area to find the right expert. My journey to the right doctor. After my conversation with General Madison and his brothers, I was motivated to seek specialized care. It wasn't easy. I faced several dismissive doctors who attributed my symptoms to stress or overexertion. Persistence paid off when I found Dr. Erickson in Seattle, a surgeon renowned for his work with EDS patients. His expertise made all the difference in my treatment plan. Dealing with medical gaslighting. Standing your ground. Medical gaslighting occurs when healthcare professionals dismiss or downplay a patient's symptoms, leading them to doubt their own experiences. It's unfortunately common, especially with conditions like hEDS that aren't well understood. Signs of medical gaslighting. Being told it's all in your head. Your symptoms are attributed to anxiety or stress without proper evaluation. Dismissal of symptoms. Doctors ignore or minimize what you're experiencing. Reluctance to order tests. Providers refuse to conduct further investigations. Strategies to advocate for yourself. Document everything. Keep a detailed symptom journal, including dates, severity, and triggers. Bring a support person. Having someone with you can provide emotional support and serve as a witness. Ask questions. Don't hesitate to seek clarifications or challenge dismissive statements. Seek second opinions. If you're not satisfied with one doctor's assessment, consult another. Personal reflection. I can't count the number of times I was told, you're too young to have these issues, or maybe you're just stressed. It was infuriating and disheartening. But remember, no one knows your body better than you do. Stand firm in your conviction and don't let anyone undermine your pursuit of health. The importance of documentation. Keeping accurate records is essential. It not only helps you communicate effectively with healthcare providers, but also tracks the progression of your symptoms. How to maintain a symptom journal. Daily entries. Note any pain, fatigue, injuries, or other symptoms. Severity scale. Rate symptoms on a scale, like 1 to 10, to track changes over time. Possible triggers. Identify activities or conditions that worsen your symptoms. Photos. Visual documentation of physical symptoms like swelling or skin changes. Tools and techniques. Apps. Use health tracking apps designed for symptom management. The poor man's tilt table test. Monitor your heart rate and blood pressure upon changing positions to document signs of POTS. Aggressive workout plans. Record how your body responds to different exercises. Personal reflection. Documenting my symptoms was a game changer. When I finally met with doctors who were willing to listen, having detailed records made it easier for them to understand my condition. It also gave me a sense of control in a situation that often felt overwhelming. Understanding diagnostic criteria. Knowing the criteria doctors use to diagnose hEDS can help you understand what to expect during the evaluation process. The Bite and Score. A simple system to assess hypermobility, scoring flexibility in various joints. A higher score indicates greater hypermobility. Tests include bending your pinky finger backward beyond 90 degrees, touching your thumb to your forearm, placing your palms flat on the floor with straight legs, hyperextending your elbows, and knees, and touching the floor with straight legs. Additional criteria: skin features, texture, elasticity, and scarring. Your family history, genetic predisposition plays a role. Systemic symptoms, GI issues, cardiovascular symptoms, etc. The diagnostic process. Medical history review. A comprehensive discussion of your symptoms and family history. Physical examination. Assessment of joint flexibility and other physical signs. Laboratory tests may include genetic testing or blood work to rule out other conditions. Referral to specialists. Additional evaluations as needed. Mental and emotional preparation. Getting diagnosed can be an emotional roller coaster. It's normal to feel a mix of relief, fear, and even disbelief. Coping strategies. Educate yourself. Knowledge reduces anxiety and empowers you to make informed decisions. Support system. Lean on friends, family, or support groups who understand what you're going through. Mindfulness and meditation. Techniques to manage stress and stay grounded. Personal reflection. Receiving my diagnosis was both a relief and a source of anxiety. On one hand, I finally had answers. On the other, I was facing a chronic condition with no cure. Accepting that reality was tough, but it was the first step towards managing my health effectively. Steps after diagnosis. Once you have a diagnosis, you can begin to develop a management plan tailored to your needs. Building your healthcare team. Primary care physician. This is going to be who coordinates your overall care. Specialists, rheumatologists, cardiologists, physical therapists, ortho, etc. Mental health professionals. Helps navigate the emotional aspects. Developing a treatment plan. Medications for pain management, cardiovascular symptoms, mental health, etc. Physical therapy. Customized exercises to improve joint stability, and it is so important to get with a knowledgeable physical therapist that knows hypermobility. Lifestyle modifications. Diet, exercise, and activity adjustments. Surgery. In some cases, surgical interventions may be necessary. Personal reflection. My treatment plan was comprehensive and required coordination among multiple specialists. It wasn't easy, but having a dedicated team made the journey manageable. Remember, treatment isn't one size fits all. It should be customized to your specific needs. Overcoming barriers. You may face obstacles such as insurance issues, financial constraints, or lack of local specialists. Tips to navigate challenges. Insurance advocacy. Understand your coverage and appeal denials if necessary. Financial assistance programs. Look into grants, nonprofit organizations, or hospital assistance programs. Telemedicine. Virtual appointments can bridge the gap if specialists aren't nearby. Community resources. Support groups can offer practical advice and emotional support. Conclusion. Getting diagnosed with HSD/HEDS is a critical step towards taking control of your health. It's a journey that requires persistence, self-advocacy, and resilience. Remember, you're not alone in this process. Key takeaways. Trust your instincts and listen to your body. Be proactive in seeking out knowledgeable healthcare professionals. Stand your ground against dismissive attitudes. Keep detailed records to support your case. Build a support network to help you navigate the challenges ahead. Your journey is unique, and your strength lies in acknowledging your struggles and fighting for your well-being. In the next chapter, we'll delve into understanding your body's limits and how to navigate them effectively.